Hello, everyone. It's Tuesday, May the 5th. Today, thank the good Lord above, we don't have any additional deaths to announce. We haven't had a death since Saturday. That's good. We still, though, have lost 50 too many people in the state of West Virginia, as far as I'm concerned, and as all of us are concerned. But I would ask you, as I do every time that I'm with you, I would ask you to keep all those people in your thoughts and prayers, and all their family and friends, because each one of these people have a name. Each one of these people, you know, are great West Virginians we've lost, and so I ask you please to keep them in your thoughts and prayers, and we'll just keep moving forward. They won't be forgotten. Week 2 of our reopening of West Virginia Strong, the comeback is officially in effect. Again, we are telling people we are allowing you to open and not requiring you to open. The safer at home order is in effect. The order strongly encourages all West Virginians to remain at home, but no longer orders them to stay at home. Week 3 of the reopening plan will begin on Monday, May the 11th. Yesterday, I announced that wellness facilities supervised by licensed professionals and drive-in movie theaters will be permitted to reopen. Guidance for these businesses is now on our website. We don't have a lot of stuff today, but under Workforce West Virginia, West Virginians who have exhausted their regular unemployment benefits are now eligible for pandemic emergency unemployment compensation that they can apply for now for a 13-week extension on their unemployment. The additional weeks of benefits are provided through the CARES Act and will be available to individuals who previously collected state and federal unemployment compensation but have exhausted those benefits. Applicants may apply for the extension tomorrow by visiting the website on the screen. We're the first state, you know this, that was able to provide the additional $600. On the benefits of the CARES Act. And some states, as you also know this, are way, way, way behind us and are having a whole lot more problems than we had. We tried to jam all those things into that bottleneck, and we threw more and more and more workers at it, and we were able to clear the deck and get it done. On Friday, our self-employed will start to be paid. I think I announced that yesterday. I want to just jump to just one other thing. You know, there's business rumors that keep going around and circulating all over the place and everything. One of them was at I think a skating rink or something in Huntington. I want you to know that these have been rumors circulating on social media about businesses that have been given special permission from my office to reopen. These are absolutely just nothing but rumors. Don't believe them at all. My office does not give special permission to any businesses to open, and all businesses' openings will be announced by my office. It's a really, really, really important time that we've gotten so many other issues that we just cloud over a lot of stuff. But this is the National Teacher Appreciation Week. So from my office and myself and all those wonderful kids that are out there and everything, we want to wish out, or to pass out our love and thanks, to all of our great teachers that have done great work for us over the years. And so we hate you're not in the classroom, but we know that you're still trying to help our kids in every way. with all the work that you're still doing online and able to help our kids and reaching out to their kids. So thank you for the love that you've given our kids and the great work you've done over and over. I guess the last thing that I've got on my list right now is I do want to give you this report on these graphs if we could. Yesterday, where we've been tracking in the ones and everything, we jumped up to like 2.7 yesterday. Still a good day. You know, our overall trend line is still trending in a good way. The cumulative number is 2.26. I can't recall what it exactly was yesterday, but you know, our positives, you know, on yesterday, on one day, jumped to 2.7, but our trend line still is great at 2.26. All that's working well for us to be able to come back and bring ourselves back to life. You know, our R0 number, which is basically the transmission ability. You know, one person, how many people does it, you know, does that one person infect? And when you keep it under 1 to 1, you're doing great. Right now, we're at 1 to 3/4 of a person, and so we're doing even better, significantly better. In fact, you know, I think on Saturday we led the nation, and I think overall we're about third in the nation, but all that's working really well. One other thing I think, you know, I could report to you is, you know, the number of active cases that we're working now in West Virginia is 510. The lines crossed on the graph. The orange line is the number of cases that now have actively recovered. And so, you know, the active cases that we're working is 510. The recovered is 667. We want to recover significantly higher as we keep on going. But on, I think it looks like April the 28th, it could have even be pushed back a little bit to my birthday on April the 27th. But that's when the lines intersected and they were even. We want the orange line to be much higher, and it is trending higher every day. Good stuff. So my last today is just this. I tell you again that we got to be counted. Please help me. Please help me in working on our census and call anyone and everyone and ask them to help too. And let's get a pyramid of people that are absolutely pushing all of us to be counted, because every person that's counted in West Virginia will be more federal dollars to us and be more things that we can do for West Virginians. So be counted, West Virginia. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, hello this afternoon. It's always wonderful to be with the citizens of West Virginia. So I have a few comments. Number one, and the governor has really emphasized this, that we have done very well as a state. But we also know that as we start to come back out again together, the risk is in many ways even more sophisticated, more nuanced than it was to begin with. What I mean by that is that our first response, which really was completely related to the great action and the cooperation of all of our citizens, was to use our hammer to suppress the activities, help people stay at home. You guys did that so well. Social distancing, reducing, wash hands, reduce touching face and nose. And with that, we ended up doing extremely well. Now that we're coming back out, though, we know that the risk is increased because the virus is still there. We have flattened the curve to buy ourselves more time, but we have to be even more sort of thoughtful now. When we look at other states that have opened, for instance, Texas, which is open, experienced its highest 2 days of increase in the number of positive cases and had about 68 deaths over the weekend. Georgia, on an incidence basis, on how many cases per 100,000, have been reported to go up over the last few days to a week or so. So we know that as we go back out again, we have to be extra careful. And we've talked about wearing face shields or face covers or masks, which are really important here. But we should not think that we are finished with the COVID pandemic. And in fact, we know that because of our rate of positivity so low, that a lot of citizens have not yet been infected with COVID. And as the governor has said many times, we have the most vulnerable population in the country. So as we go forward, what we want to do, and we have started to aggressively reopen West Virginia, and we're watching closely the numbers the governor's talked about. But I think this week we have reduce the aggressiveness of some of the reopenings. We're going to let things kind of play out for a week or so. Certainly, opening up health rehab facilities that are supervised by professionals is important. You know, having people be able to go out and be outdoors and see entertainment is good as well. But we know it takes about 10 days to 2 weeks to see the initial excuse me, the initial impact of some of the reopenings and the coming back together. And then it takes about 2 cycles of that to see the full extent. So we want to make sure that we are giving enough time to see what is the real effect from a health and well-being standpoint for the first part of what we're doing, still continuing to open up and to allow businesses to start to regain jobs and economy. But also, we want to make sure that we are giving businesses as we go forward, whether it's, bigger businesses that are national chains or some of the businesses that have started, like the hairdressers, the barbershops, the pet grooming, the small companies. We want to make sure we give them the right guidance and the right support because a lot have reached out to us. So West Virginia, we're doing really well, and congratulations on your efforts. We need to continue that, and we know that doing it cooperatively and doing it together is really important. So when you go out, still be cautious, take precautions, wear your face masks or wear your face coverings that not only protect you from others, but actually protect others if you would happen to get infected. So thank you for all you're doing, and well done, West Virginia.
Thank you, Dr. Marsh. Now let's go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Let me talk a little bit about telehealth. Because of the pandemic, we instituted changes with regard to telehealth services in the state. Those have been hugely successful. I want to mention that there have been some questions with regard to elective procedures coming back online and whether we would continue telehealth. We are continuing telehealth services throughout that period. Once the public health emergency is lifted, we will discuss going back to a different approach, but I want to make sure everyone understands telehealth is successful, and we plan to keep telehealth in place in some manner. It has been successful, and I would mention that the children appear to love this, is what I'm told. So let me mention a little bit about the pandemic electronic benefits transfer that I mentioned yesterday. We announced that that's through the Department of Agriculture, Food and Nutrition Services, and Department of Education. And again, I want to thank Superintendent Clayton Birch, who are great partners with us moving forward with quite a few areas here. But the PEBT cards will provide free school lunch and school breakfast and lunch reimbursement rates for days that schools are closed. So those are very important to many families. They can be used everywhere that SNAP EBT are used. But I want to mention that if you currently receive SNAP, Medicaid, or West Virginia Works for a school-aged child, you should receive your PEBT benefits on or before the middle of June. Benefits will be added to your existing cards, so you don't need to do anything there. If you do not receive SNAP, Medicaid, or West Virginia Works for a school-aged child, you should receive your benefits by mail by the end of June. So if you have any questions, please contact DHHR on that. That's all I have. Thank you.
Right, thank you, Secretary Crouch. Also with us today, we have Major General Hoyer with the West Virginia National Guard and Jeff Sandy, Secretary of the West Virginia Department of Military Affairs and Public Safety. They are both available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Mark Curtis with Nexstar Media. We may have trouble connecting with Mark. Next, we'll go to David Beard with the Dominion Post. David, are you there?
I'm here. Thanks. Last week, Secretary Crouch mentioned that there would be an advisory group working with DHHR to help compile the data for the African-American communities. And I've been asked if that group has been assembled and is it doing its work? And what's the membership? How many people are on it and who's on it if it's been assembled? Thanks.
Governor, would you
No,
like me to
Secretary
take
Crouch,
that?
go ahead, sir.
Yes, we have done a great deal of work on that. We've gotten a lot of help from Jill Upson of the governor's staff, and we are close to putting that all together and being able to make an announcement. So we'll get that information to you just as quick as it's available.
And if I could, well, just one second. You know, Bill, I mean, hold on. Let me give you a little more definitive answer than just that. And maybe Brian Abraham, you want to step in with Secretary Crouch and everything, because we've compiled a lot of numbers and everything in the African American community, and I think we've got some good numbers and good stuff to report.
And I'll leave it up to you, Secretary Crouch, but my understanding is you've actually compiled the raw data and you have that now available. Is that correct?
That's correct. We have compiled that. We have membership recommendations drawn up for the governor. We've looked at, for that advisory group, making sure we had geographical distribution for that. We have numbers from every county with regard to the African American population and the positive rates. So again, we're very close to presenting all that to the governor for his decision.
All right, thank you, David. We'll try Mark Curtis again with Nexstar Media. Mark, have you gotten connected?
Yes, I'm here. Sorry about that. I had a little technical problem here. Governor, I know you said that the backlog has been cleared at Workforce West Virginia, but for a number of days I've gone down to the workforce office here in Charleston, and there are people waiting outside who say they've filed their benefits. Some say they've been approved. One gentleman showed me a letter that was approved and then another letter saying he was disapproved. I'm not saying these people didn't get their paperwork done. I mean, obviously it's in, but they're not getting their benefits and they're trying to find out where their checks are, where their money is.
Okay, Mark, let me start off and then I'm going to pass to the general and everything on this. But here's my feeling. My feeling wholeheartedly is just simply this. There are situations to where we will have people, and there's discrepancies in information and whatever like that, and there's issues there. But I don't like it. I don't like it when one person is not served and one person is still hurting. And so, I'll go back and review again right as soon as we get through here. But General, if you could add, some thoughts or hold on just a second, my general counsel, Brian Abraham would like to, throw in some information, but I want everybody taken care of, but maybe we could go to Brian Abraham right now.
Mark, just generally speaking, the governor has waived every obstacle you possibly can for these people to claim their benefits, but there are some instances when individuals, file their claim, the information is so incorrect in it, it takes manual fixing by the department. They have to reach back out to these individuals, and sometimes that contact information is not even included within the claim. I'll give you an example. What Scott Atkins relayed to me. One individual sent in their application and listed their address as the address of the actual workforce office in Charleston. They asked what their employer was, and they listed COVID-19. So that, they had difficulty processing that claim. They have to manually reach out to those people and try to get them fixed. So when you multiply that by the numbers, there's going to be those people that still have claims outstanding that have to be fixed. And I know they're working every day to get that done.
To me, just a second, Jordan. Let me just say this, and again, not adverse to my general counsel here, but it's just as simple as this to me. People can get confused, and people can put down stuff on an application or whatever like that and make mistakes. Like your employers, COVID-19, and people are, I totally understand how people can be nervous and everything and make mistakes. That's okay with me. We still have to take care and work every single claim, and I understand the frustration, and we're going to just keep pounding this until we get it absolutely perfect. And General, if you've got anything to add, please do. But my patience is not good with this. We want it to be perfect.
Yes, sir, Governor. And Mark, if you have individuals who have not received benefits, if you can pass them to us or have individuals who are out there who have not received benefits work through the Constituent Services Office, we will work with Workforce West Virginia to track down each individual's status who may not have received the appropriate information and work to address those as the governor has directed.
All right, thank you, Mark. Next, we'll go to Kenny Bass with WCHS.
I had a question about the story that was in the newspaper about the masks that weren't quite N95 masks. They were kind of sort of like N95 masks, and they were purchased for a lot of money. I just wanted to ask the secretary, if he's available, how was that company vetted? How exactly was that purchase vetted before the check was delivered?
Well, first of all, thank you very much for bringing it up, Mr. Bass. This is really quite simple. If you go to Beijing in Shanghai, they have a catalog in English and they have a catalog in Chinese. If you pull up their catalog and look at the N95 masks that are the 3Bs and the 3Xs, they have what is called head straps on those. If you look at their Chinese catalog, you will see that the 3Xs just have ear straps. So what's happened was on April the 10th, a West Virginia fireman was concerned, and he brought it to the attention of DESON and stated, "I think we got counterfeit masks." And as a result, there is a 12-hour difference between West Virginia and Shanghai. So Easter morning, starting about 1 a.m., we started an investigation on this, Kenny. And we worked our way through 7 layers. And I can spend hours on this because this investigation was hours. But we went through 7 layers. Our shipment of 100,000 masks was part of an order that was a total of 10 million. And those 10 million masks went all over the world, including Israel. The 100,000 that we received was a mixture over multiple weeks, ones with head straps and ones without. So what we received was the Japanese version of the N95. Now, where do we go from there? We were able to show, and we've got through a lawyer in Houston, Texas, we were able to get her to be our interpreter, and she is an attorney of good standing, and she was able to interpret interviews and also documents for us. So when the word counterfeit is used, these masks were manufactured at the world's 2nd largest mask manufacturing in China. So are they NIOSH approved? And as I've stated, the ones with the ear straps were not. However, The United States was being bombarded with millions of these every day in shipments from DHL, FedEx, UPS, et cetera, coming into the country. And on April 3rd, the CDC works with the Food and Drug Administration, and they stated that the masks that we received with the ear straps were approved for use in the United States of America. Now, where else would you like for me to go on that, Kenny?
Well, they're approved for use, but are they approved for use for frontline COVID-19 workers? Because that's where the massive shortage was. And who ultimately approved the purchase of these non-N95 masks? Were they ordered by mistake, or were they delivered by mistake?
No. How that came about is we had a West Virginia resident who was a vendor for the state of West Virginia. And that individual came forth and stated that through his contacts that he could obtain masks for us. And the masks were ordered through him. He was vetted. He has had no issues. In fact, he has supplied safety equipment for West Virginia law enforcement and first responders for decades. He's well known here in Charleston. His supplier that he went to is also a former West Virginia resident whose parents still reside here. He's in South Carolina, and he was also vetted. And during the investigation, again, we traced from West Virginia to South Carolina to Texas, from Texas through the importer to the exporter to the factory. So again, these masks are, per the FDA, the ones with the ear straps are non-NIOSH, but they are allowed to be used. In the report that we've been giving out that I did, Israel purchased $30 million worth of these in the KN95s. And if you look at my report, the mayor of Jerusalem has a KN95 mask with the ear straps versus the back strap.
All right, thank you, Kenny. Next, we'll go to Annie Moore with WVVA.
Hey, Governor, it's Annie with WVVA. It's my understanding that some of the private labs across the state are doing the antibody tests. Are those results being reported to the state? And if so, have we gotten any insight as to whether the virus could have been here earlier than March?
I think, Dr. Marsh, that's right in your wheelhouse. Go ahead.
Thank you, Governor. So, Annie, it is my understanding that the antibody tests are being stood up, particularly I know WVU Madison is setting it up and LabCorp provides it. There may have been some intermittent incidents of some of the mail-in sort of point of contact tests that have been used. But my understanding is those type of assays, which are called lateral diffusion assays, are not nearly as reliable or accurate. So from our perspective, as far as the use and the ordering of antibody tests, either from inside the state or using a third-party vendor or a partner vendor like LabCorp, my understanding is that those have not been done at any scale, and therefore there's also there's an issue about accuracy from some of these other kind of tests. So I don't think there's anything reliable out there. There may be small little pockets of people that have used some of these mail-in tests or these point of contact tests, but we are planning to use the antibody tests as they become more accurate and reliable from reliable sources. So more to follow on that. Thank you.
All right, thank you, Annie. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, this is Taylor at the Herald-Dispatch. I was just wondering if we could go back to yesterday when we removed some more counties from the hotspot list. I know we're going to have more new methodology midweek, you said, but I just wanted to see if we could go into a little bit more detail about what went into removing Cabell and Wayne County and the other counties from that list.
Okay, and I think it was Taylor, but Taylor, I'm going to pass this to Dr. Marsh and let Dr. Marsh elaborate on this more. But But there's a lot of work that's going in, and as we look, closer and closer at these hotspot counties and everything that, and we try to obtain as much feedback as we possibly can. The one thing I caution everybody on is just this, is we're going to make this decision in the governor's office about the hotspots. We're going to bring in as much information as we possibly can, and then we're going to release counties, as to what the governor's office thinks is the very best. We'll have absolute feedback from the counties themselves, but if the counties are, wanting one thing, and I just had it brought to my attention just this, that we have a county that's still on a hotspot list, and we have people that are out there saying, well, we wanted to stay on the hotspot list because that means we get more PPE, or maybe we get more federal dollars. Well, I don't have any idea where this stuff comes from, that people come up with. But, I can't see in any way that's legit, and the bottom line is I don't want other counties, to feel like, well, we're taken off a hotspot list, so we're going to get less. I mean, we need to be making that decision in the governor's office. That's what we'll do. But Clay, you can go in from there.
So thanks for the question. What we're trying to do, and I think Dr. Slimp will come on perhaps tomorrow or so and explain in more detail. But what we're trying to do is transition from looking at the state as just a single entity and then starting to look at the state made up of all the counties so that we can make our view finder more specific at the county level. So when you look at West Virginia today, or at least yesterday, we had about 25 or so active cases that are community acquired per 100,000 population. And instead of using just a number of cases, which was the way that we started, because as it was building, we were a state that didn't have very many cases to begin with, and chose an arbitrary number of over 20 cases. And that was when we, at the beginning, started to worry about clusters and hotspots. And so what we really want to do now is look at the rate of change. And we want to look at the rate of change over a 7-day rolling average. And we know that, for instance, the counties that are lower in population, a few cases will make a huge rate of change. So we want to look at trying to separate the low population counties from the higher population counties, and then look at that sort of on the basis that we start about 25 cases per 100,000 across the state, and then look at that rate of change per 100,000 population so that we can start to see the counties that might be moving faster than some of the other counties. And as we apply this methodology and start to look at that, it's clear that some of the old methodology we used, which was on a total state basis, really wasn't as sophisticated and precise, again, really going from the hammer to the scalpel, as some of the methodology that we're starting to look at. And some of these counties, it became obvious because of the lack of new cases and the idea that many of the cases may have been in congregate settings and nursing homes or other type of facilities, as opposed to community spread. That's where we started to look at who maybe should be on the list, and we may change hotspot because maybe that's stigmatizing, and which counties could come off. And of course, as the governor said, it's really the governor's decision with the HHR and those of us who are on the health team, but also it's done in close collaboration with the local health officers that do really such a great job in our state. Thank you.
All right, thank you, Taylor. Next, we'll go to Amanda Barron with WSAZ.
Hi there, Amanda Barron from WSAZ. I wanted to follow up on the article that was in the Izzet Mail and Kenny's question. So was there a mistake when ordering those masks, or in a mistake in what was received and shipped from the company? And then beyond that, as I understand it, those masks are approved for surgery in the U.S. right now, but not for COVID-related response. And I was hoping you could elaborate on that.
If in our information that we have released, there's the FDA report that covers why they did this due to the coronavirus, and that these masks are to be used in the fight against the coronavirus. Okay, so did that answer your question? I have a different aspect from talking, and I'd like to point out for everyone back on April 1st, through the governor's office, they asked us to put together a team to evaluate and make sure that the PPE that we're getting in the state is legitimate, not counterfeit. In our Department of Homeland Security Emergency Management, we put together a team which includes federal Homeland Security, the investigators with the Food and Drug Administration, and with ICE, in fire marshal, state police, et cetera. So we have a team that has been working, and in fact, it has saved the state hundreds of thousands of dollars by not purchasing PPE that, without question, has been determined to be counterfeit.
All right, thank you, Amanda. Next, we'll go to Paul Mullen with WCBC Radio. May have dropped Paul.
Good afternoon, everyone. Got a question from a bride-to-be in Morgantown, West Virginia. Said she needs some guidance on how to plan her wedding. Said that she's going to be married around the 4th of July, I believe, and wants to know if she could have a wedding with 250 people, and if she does that, how she's going to pull that off.
Let me take a shot at that. You know, if she's needing advice from me, tell her first and foremost to marry a good guy, a guy that really and truly is will stand up for her in every way and will be with her forever and ever. But and I would tell her just this, that I hope and pray she's going to be able to have the wedding. There may be some few little tweaks, you know, as far as the number of people, you know, as how they're situated there and everything. But all I can tell you on that is, as we go forward, we're going to continue to try to update, be completely transparent, and tell her and all West Virginians along the way all the things that we can do and that we can't do. You know, it may very well be that we got a setback, and then we've got to address that and everything. But as we move forward, if we keep moving the way we're moving, I hope and pray she'll be able to have the wedding and enjoy her being a beautiful bride.
All right, thank you, Paul. Next, we'll go to Josh Krupp with WDTV.
Hi, Governor. What are you looking for in this minority advisory group? Will they be working behind the scenes, or will they have representation in these briefings? Essentially, what do you expect and want from them?
Well, again, from my standpoint, you know, I want everything transparent. You know, there's so much that we've already done and everything that I wish to goodness that we would just come right out and you can, you know, and tell the people all the things that have already been done. But maybe, you know, I think Secretary Krause wants to bundle it all up, and maybe tomorrow we can come with more definitive numbers and everything of all the stuff that's already been done. But, you know, we want to absolutely continue to try to protect all West Virginians, and we absolutely recognize that, you know, that in the African-American community that we could, on a national basis, more African-Americans were affected than whites or whatever it may be. And so we know that there was an issue there, and we're absolutely, we've already done lots and lots and lots of work. And we want to make sure that we do exactly what we should do and take care of all of our people. Tomorrow, if I could say one last thing, tomorrow, Secretary Krause, you know, come with real numbers, and between my general counsel and Secretary Krause, we'll have a better report for you tomorrow.
All right, thank you, Josh. Next, we'll go to Brad McElhinney with West Virginia Metro News.
Hi, Governor. Hi, Secretary Sandy. Hello, everyone. Governor and Secretary Sandy, can you elaborate on whether you are comfortable with West Virginia emergency responders having these masks that may have a lesser seal around the ears, as I understand the issue? Are you comfortable with them wearing those masks as a protection against COVID? Also, there was a description of a vendor with West Virginia ties. Can you specify who the vendor was?
Well, I'll start. The vendor is Ballard Safety Equipment in Martinsburg, West Virginia. And the person in South Carolina that assisted him in making contact with the Texas companies was Steve Polly, whose family again still lives here in West Virginia.
And Brad, let me fall back and just say just this, okay? You know, I don't know all the particulars, and you know, whether it be DMAPS or it be the Guard or whomever is handling all this and everything, every state was scrambling around every way you could possibly scramble. The federal government was scrambling around every way you could scramble. From what I understand from Secretary Sandy, you know, these were not counterfeit masks, and these were masks were approved by the FDA for use here in the U.S. Now, some of them that we got were NIOSH approved, you know, and some of them are FDA approved. But the real facts is just one thing, and that's just this, is when this was going on, everybody was scrambling in every direction whatsoever to try to get any and all protective equipment that we could possibly get. Everybody was doing that. You know, our federal government was doing it. We all know what China did. I mean, what China did was, first of all, they had an issue. And then when they had an issue there at that lab and everything, what did they do? They went out and bought all kinds of equipment, hoarded it all up and everything, knowing that what was happening and everything within their own country. And, you know, if you'll just listen to our president and everything, you'll see a man that's terribly upset with the way China reacted and what China did and what happened. You know, in the United States now, I don't know if we've approached 70,000 deaths, but we've lost 50 great West Virginians. We've lost 70,000 great, you know, Americans, almost. And before it's over, we're going to zoom right past 100,000 probably wonderful Americans, and maybe all this could have been stopped right there in China. It's ridiculous and everything. But I can tell you that we all got caught in the situation, every single American, every single state. You know, we were scrambling in every direction trying to find masks, and the people, whether it be the Guard or DMAPS or whomever it was in this state, you know, we absolutely dropped everything and tried to purchase everything and anything we could to be able to protect our people, because our people had no protection and everything. And so these, you know, I'm sure that these masks were administrated, you know, to fire departments and first responders, whoever it may be. I don't think these masks went into our hospitals. So I'm not the guy that you need to talk to about the specifics and way down in the weeds on that, but I can tell you that really and truly, a lot of people are probably getting beat on here that did a lot of good work too.
All right, thank you. We have time for one more question. We'll go to Anthony Izzet with the AP.
Secretary Sandy, doesn't it give you pause when you have the CDC raising questions about those masks? And do you have any plans to recall them or modify their use for first responders?
Well, let me address the first one. I have worked in Israel, and in my investigative report there, these masks are being used by law enforcement first responders in the country of Israel. So let me state that there. Now, if you look at the email chain relative to the CDC, on the 10th, the CDC stated, these have loops, these are counterfeit. Then when I get involved and start asking questions, and you will see it, the tone changes somewhat in that these possibly could be counterfeit. And then on the last email relative to that, which has been released today, it even states that when using these, make sure that they are you fit these on properly. And so there is a gradual change because we cooperated fully with the CDC and we provided them with the documentation, both the Chinese version and the translated version of the path of how these were purchased eventually from the factory in China.
All right, thank you, Governor. I'll turn it back to you.
Okay, thank you, everybody. And let me just touch on 2 or 3 different things here real quick. We've had a bunch of calls in regard to the little leagues or the youth sports and even the Hatfield and McCoy's trails. And I want to tell everyone just this, and this is just me, but if there's a way that we can get back to playing Little League baseball this summer, I want to get back to playing Little League baseball. If we can get back to having youth sports, I want to be able to do it. And I also know that we've got to give our little leagues, our youth sports, a date in which they can shoot for and go back. And I'm really, really hopeful that date is somewhere really close to June the 1st if we can pull it off. We may have to, stress upon our people, the fans or whatever, or our practices and so on like that we just try as best we can to keep, as much social distancing and all that as we possibly can. And we remind everybody over and over and over that this dreaded disease, attacks the old, and we've got to absolutely make sure that we look after our elderly in every way. And the other thing is we just continue to do all the things that we've said 50,000 times over, and that as far as the social distancing or as far as the washing your hands and all that kind of stuff. So please, West Virginia, continue to do that, and we'll give these leagues and youth sports and the Hatfields and McCoy's Trail that I'd love to see us be able to get back open, but I totally understand people coming from out of state and all the issues that go with that. And I also understand the economic impact of Southern West Virginia, but I have all the confidence in the world in the great people of Southern West Virginia. Will keep those cabins spotlessly clean, and they'll work very, very diligently when we do bring back the trails. Let me just think. I do want to end with just this, if I could, please. And Jordan, maybe you could, if you've got these graphs, do you have the graphs of percentage of test positive and the percentage of population tested?
I don't, but we can make those available on the website.
Okay, well, we'll make those available like on the website, just what Jordan just said. But I'll just tell you these numbers. And again, West Virginia, you should be terribly proud of these numbers because you've done unbelievable work. But right at this time, the United States, as far as the percentage of test positives, is running at 16%. Virginia's running at 17%. Pennsylvania's at 20%. Ohio's at 13%. Maryland's at 19%. And Kentucky is right at 9%. And you, West Virginia, again, there's 16, 17, 20, 13, 19, 9, and you're at 2.26. So you're doing really, really good, and keep up the great work there. And the other thing is the percentage of population tested. West Virginia, you are now at 3.08% of percentage of population that have been tested in West Virginia. The nation is at 2.2% on testing, and the closest state to you is Maryland, and they're at 2.25. You're at 3.0, or really at 3.1. The nation is at 2.2. Maryland is at 2.25. The number in Kentucky is 1.2. Ohio is 1.3. Pennsylvania 1.9, and Virginia 1.3. So basically, you have tested, per your population in West Virginia, you have tested almost 3 times the number of people that Virginia, Ohio, and Kentucky have tested. Not quite 3 times, about 2.5 times you have the number of people tested, and you have tested significantly more than Pennsylvania, significantly more than Maryland, and significantly more than the nation. So West Virginia, you're doing good. You're doing good in lots of different areas, and I'm really, really proud of you, and please keep up the great work, and please keep those that we've lost in your thoughts and prayers, and all the people that are out there that are doing the good work, thank you. Thank you so much.